Your first visit, our main focus is to find out what the problem is and what is causing your pain. And that always starts with a very thorough history. You want to find out where your pain is, how long you've had it, if it radiates anywhere, if it's sharp, dull, numbness or tingling, other factors such as what other treatments have you tried, what other images have you had, how long you've had it, how it affects your activities of daily living. We want to get a very in-depth analysis of this problem from your telling us what's going on with it. Now, typically with spine problems, the pain originates from one of three sources. It's typically either the disc, the nerve, which would include the nerves as they exit the spine, or the spinal cord, or the central canal in the low back, or it might be the joint, meaning the facet joints and the soft tissues around them, such as the ligaments. So our exam process is designed, a very thorough orthopedic exam, sometimes over 15 different tests, can help me identify whether the pain is coming from the disc, the nerve, or the joint, and that allows me to determine a proper diagnosis and which imaging to order, MRI, CT, or X-ray, based on what the exam findings are. The exam process includes biomechanical measurements, such as altered leg lengths, hip displacement, neck and shoulder alignment. We also do very thorough standard medical orthopedic testing of the neck and the back to separate whether it's a disc, nerve, or joint issue. We also do neurological testing. So we test to make sure the nervous system is functioning properly. This may include an upper or lower motor assessment, and it may include a cranial nerve exam as well to determine if there's any underlying more serious problems that may indicate a referral to a medical specialist or the need for an MRI. We also have a specialized test for our injury patients called dynamic range of motion with EMG. Staff hooks up the patient with these, it looks like an EKG, like you would get if you had your heart tested, but they're called EMG, and they're hooked up to the muscles of your neck or your back, and you go through range of motion, and the test also measures how the muscles are firing normally or abnormally. So it's a very objective test to help identify where the injury is and how severe it is. With my fellowship training, I did a 2-year medical fellowship in spine where I was cross-trained in the different medical areas of spine, such as neurology, neurosurgery, orthopedic surgery, primary care, and even emergency department medicine for spine analysis. And so my testing indicates whether we need to order additional tests, a specialized MRI, maybe a CT scan, an EMG, NCV. So we always keep in mind what's in the best interest of the patient and any necessary referrals for specialized tests.